Coming up next on WVOX, licensed insurance agent and Medicare specialist Mark Brownstein hosts his monthly educational segment, Medicare Mark on the Air. Tune in for guidance, special guest interviews, and valuable information on all things Medicare.
Good afternoon, everyone. This is Mark Brownstein. Often people refer to me as Medicare Mark. I'm very proud to be of service to so many for so long on the topic of Medicare. This is the first show for me here in Westchester. I actually do a show in Rockland as well, and I bring on guests around healthcare. I bring on doctors and nurses. I bring on people from financial planners, estate attorneys, people from Meals on Wheels, people from the Alzheimer's Association. Hopefully, it will add value and educate you on various topics. My area is Medicare, though I do help people with other areas that are relating to senior care issues. I'm an elder advocate, which means that I have credentials in other areas to support people who are really looking to address issues like home health, assisted living, nursing homes. And that's what I actually did before I became a Medicare specialist. I've been doing this, and my team has been doing this for almost 7 years now. We love what we do. We support so many people. We have around 1,000 clients currently, and I probably educate about 1,000 people a year on Medicare. People are always curious about Medicare. People are curious when they turn 60, when they turn 63, when they turn 64, and even after 65, when they retire and they've had good coverage, they're still curious. As we know, there's so much information that comes to your mailbox, on TV, that is trying to encourage you to move towards a different kind of a plan. So again, I'm here to offer education, to be a resource for you to potentially ask questions of myself and of guests. But my comment up front is always around Medicare, is that one size does not fit all. And Medicare planning and thinking about this ahead of time is really important. People hear from their friends, their relatives, their colleagues, often misinformation about what the timing is on Medicare. Many of you on the air are probably on Medicare, and many of you may be looking at Medicare. And Medicare is, in some cases, a tremendous opportunity to get really good health care. But one has to understand the rules and the timing. So for people who are turning 65, people who are working for a company that's larger than 20 employees, they can hold off in making these big Medicare decisions. Many people, probably most people at 65, feel inclined to get Part A, which is hospitalization. And so there's no reason not to get it. It's just the hospitalization piece. It gets the Medicare process started. But one caveat or comment would be if one has a health savings account at their company, one actually cannot have Part A Medicare. So there are many companies out there who actually have health savings accounts with their employees. And when they turn 65, they often are not told that they should not have Medicare. If you do have questions in this half-hour show, again, second Monday of every month, I will be here. The phone number here is 914-636-0110. So for me, the work that I do is about educating, and that's what I love to do. I actually owned a training company for many years where I trained in healthcare and had a staff of people who traveled the country in healthcare. So healthcare has been my passion. I feel like I and my team are able to simplify this complicated, confusing component of Medicare. But some of the things that I do in this community, I'm involved in the Rotary. I'm involved in Chamber of Commerce. I belong to the Business Council of Westchester, which is a very fine organization in this community. I also was involved in creating Financial Education Day at Westchester Community College for many years. We were at the Gateway Center. We had 200, 300 people and many, many professionals being able to speak there. I'm also involved in the Alzheimer's Association. I believe in the month of June, I will have someone from the Alzheimer's Association on the show with me to talk about some of the aspects of Alzheimer's, what they offer, some of the walks that they offer for fundraising. I'm also involved in what's called Senior Law Day. Senior Law Day is a group of professionals who offer free legal and financial guidance. It's been around for 20 years. And I'm proud to be a sponsor of that as well. I've helped many people around Medicare, but it's the involvement that I've had in Westchester. I also have spoken at the Greenberg Library. I've talked at Sam's at Gedney Way. I was actually the president of the Financial Planning Association of Rockland and Westchester for 3 years. So I spent a lot of time in Westchester. My territory is generally New York, New Jersey, Connecticut. My office is in Nyack, so I'm pretty close to getting over the bridge and being able to service people. I'm actually heading to Connecticut later. So it's nice to get back on the road. It's nice to be able to speak to people. I'm looking forward to speaking to more people live. One of the things that I do often, and before COVID and certainly since COVID, I have been in front of people on Zoom and also doing some seminars. But before COVID, I probably did 40 seminars a year. And so, my goal is to continue to educate, find a balance between what people need and want in terms of education on Medicare. And again, being that reliable resource. Medicare is the kind of topic where for the first time in many people's lives, they've had to make this decision on their own, independently from their company having some say in the choices that they are being offered to themselves, their spouse, their children. And now once they get to Medicare age, all of a sudden they have to reach out to someone to be a reliable resource, an independent resource, to be able to guide them through this process. So for me and my staff, what we truly want to be able to do is speak to people 3 months before or 3 years before they turn 65 or retire. People have questions, people talk amongst themselves, and they just want to be clear. As I said a little while ago, getting Part A at 65, really no harm, no foul, unless you have a health savings account. But Part B, which is all of the doctors and all of the specialists and the x-ray and the diagnostics, all of that for Part B, that does have a premium attached to it. And so the timing of getting Part B is actually quite important. And again, a big part of the conversations I have with people so they understand. Part B, the premium for Part B, that for many people comes out of their Social Security check or is billed quarterly, went up in 2022. It was in 2021, $148.50 for Medicare Part B. Now it's $170.10. So, we've just passed January. You've probably seen a little bit of an impact on any Social Security, though Social Security did go up. Actually, Medicare cost went up a little bit more. So that's one thing that's important. But the Part B component is truly questions that I answer every single day for people. For those of you out there who are already on Medicare, the changing of Medicare plans really happens between October 15th and December 7th of each year. That's when the barrage of TV, radio, as well as phone calls, paperwork, mail, is encouraging you to look at a new carrier for new benefits. So that's really an important time of the year to sort of in my opinion, reach out to someone who you've worked with before so that they understand your situation. They've taken notes on what they've talked to you in the past. They've helped you with your medications. They've reviewed your doctors and the facilities that you use and really be a resource for you year to year. Clearly, my competition is the carriers and their 800 phone numbers, where you can call a carrier. They will do everything they can to convince you that their plan is the best plan for you. They are not necessarily independent. So I represent 15 or more different carriers, depending on the state, and I'm here to look out after your best interests, period. That is what's most important to me. That's where my reputation, our staff's credibility, and quite honestly, that's how we get referrals, is through the honesty, the integrity that we show with all of our clients. When people call and they are in a great situation, they have a great plan, maybe they have NISHIP, maybe they have a state program, teaching, they were teachers. It's very often that I'm just encouraging them to have me review their plan that they're being offered in retirement, and see if Medicare is better. If Medicare is better, we have to look at the costs. We have to look at the doctors. And then, of course, we have to look at the prescriptions. So again, this world of Medicare is really about doing what's right for the client 100% of the time. Just like any industry, there's many people who maybe don't have the best interests of their client in mind. I am proud to be connected to Montefiore in terms of being an independent broker for various insurance carriers. I'm able to help people review their employer group plan, their retiree program, but also have them understand truly the differences between what is called a Med Advantage plan and a Med Supplement plan, also called Medigap. So when I do presentations, whether they be Zoom or on a seminar, I take the time to explain where we started, which was Part A and Part B, because that's really where it begins. Once Part A and Part B is in place, then what's the next step to cover the gap? Because Part A and Part B is 80% coverage. So what is the remaining 20%? How does one want to cover that 20%? And there are really two paths that one can take. Either the HMO PPO route, where you're looking at the doctors that you utilize. Maybe you're looking at other benefits that you need, like maybe dental or vision or acupuncture or maybe even hearing aids. These are the type of Advantage plans that are low premium. But you want to be very careful so that all of your doctors or most of the important doctors are in the network. But again, low premium, if you don't have chronic conditions, these are great plans to start with. These are great plans, period. They have a high out-of-pocket maximum, but, it takes many trips to the hospital or many surgeries to get to that out-of-pocket maximum. So these Advantage plans have a copay, right? So these are considered Part C and Part D. C is the medical, D is the prescription drugs. They are a package. With the package comes some dental and some vision, depending on the carriers, depending on the year. But you have, again, a $15 copay or so for primary care, maybe a $45 specialist or so for that copay. But then each other service, whether it be an x-ray, a diagnostic test, again, hospitalization, surgery, everything will have a copay. And that's the kind of design that those plans have. You're going to see most of the advertisements around Med Advantage plans, Part C and D, in your mailbox and on TV. They're managed care. Again, they work very, very well for many, many people, especially those potentially with low budget. So that's one route, is the Med Advantage plans. And I help many, many people with them. And it's in New York. So for those of you listening in New York is very unique in that New York, Connecticut, Massachusetts, and Maine are the only 4 states in the country where if you have an Advantage plan, you can move over to these Medigap plans, these med supplement plans, without any underwriting. In another state that I work in often, New Jersey, Florida, if you start out with an Advantage plan and then years later you say, you know what, I would like to not be in a network, I would like to go to any doctor that I need to that takes Medicare, I want to upgrade to maybe a med supplement Medigap plan, the carriers can ask you health questions. In fact, they do. They can look at your medical records. They can look at the prescription drugs you take. They will do a phone interview. And hopefully you're accepted. But in not all cases are people accepted. And so, but in New York, that is not the case, nor in Connecticut. In New York, there is no underwriting. And so if one has an Advantage plan and one wants to switch over to the Medigap plans, they can do it during open enrollment. Again, October 15th through December 7th. I feel like explaining Medicare simply to the people I'm in touch with is really my job, my goal, because people come with information that they've read, information from friends, and I really just try to listen. I try to listen and understand how their health is, how their budget is, what kind of coverage have they had with their group, with their company, or through their spouse? How expensive was it? Let's look at the premiums that you've paid, and how often have you used the doctors or the facilities? All of these things being a really important part of the phone calls or, previous to COVID, the meetings that I've had with people. There are times when I will have a few phone calls and able to help them fairly quickly. People know where they want to proceed with the supplemental side. But there are times when 4 or 5 phone calls later or meetings, we're finally figuring this out. So I often say I'm not the government and I'm not the insurance company, but we have deep knowledge on how both of them operate. For instance, the Social Security offices have been closed. So without that being able to be an option for people to go in there, apply for Part A and Part B, get their Part B because they have A and now they're changing from their group plan to Medicare. We've helped fax hundreds and hundreds of forms to various Social Security offices clear across the country to help them get the right next piece in place for us to then help them through this process. So, our clients are very grateful. I love this business. I've been in many businesses. I've actually been in the training business most of my life, and again, with seniors in many capacities. But for me, the people that we work with are truly grateful for the work that we do because they really need the guidance. I have a staff of 3 people who help support me. And what they do, try honestly, is they help with all of the important work around looking at all your doctors, looking at all your medications, making sure that the applications that you submit get processed correctly, going through the carrier, getting you the information you need to make sure that when it's approved, we get you the information even before you get your card from the carriers. So we work hard. We're local. We're independent. We're passionate. I'm Mark Brownstein with Emerald Medicare. My website, please take a look, www.emeraldmedicare.com, and take a look at some of our Google reviews. Again, some people have been incredibly warm in their comments about us. We are all year long as a business. So many people who do Medicare really work during the open enrollment period, let's call it September through December. We certainly are very busy during that time of the year. But quite honestly, we are working with so many people who are turning 65 and are retiring that we are busy simply all year long. I mean, around COVID, I think we can all sort of realize, and we hear it in the news about the number of people who are retiring. moving to a scenario where they're, wanting to enjoy life. And so the calls around people retiring have increased since COVID began. And, people have not wanted to go back to work. A lot of people in the healthcare profession have made a decision. So if someone's unhappy with their plan, it's important to take a look at why. What is it that either the carrier is not providing, or what is it in the doctors that you had thought were covered are not covered? So, a phone call is always helpful. Our number is 845-358-1220. Have a staff of people hoping to be able to help you understand what we can do for you, set up an appointment with me to really understand, again, your needs. Each person's needs are truly, truly unique. So being independent, again, means that whatever carrier works best for you is what I'm going to help you with. There have been some changes to Medicare. Besides the Part B premium going up from $148.50 to $170.10, the other thing that has changed is the deductible. The deductible was $203 in 2021. Now it's $233 in 2022. So again, I mentioned earlier the Part C and D, the Med Advantage plans. And then there's these Medigap plans. These are plans that you can go to any doctor anywhere in the country that takes Medicare. And people love those. Yes, they are more expensive. And you do need a separate standalone prescription drug plan that we help you evaluate. But these plans where you can go to any doctor that takes Medicare and you're not in a network gives a lot of people peace of mind. But one has to be able to afford them. And depending on the part of the country that you live or are moving to, the prices range. They range from $50 up through $300 a month for these Medigap plans, Med Supplement plans. But people here on the call may be familiar with Plan F, Plan G, Plan N. These plans are exactly the same everywhere in the country. The difference is the carrier and the price. One thing I want to mention, and I always mention on the air at every chance I get to speak to people either on Zoom or a webinar, is New York State's pharmaceutical program called EPIC. EPIC is a state pharmaceutical program that there has two qualifications. One, you have to be over 65 to qualify. And two, you have to have an income from last year as a married couple under $100,000, as a single person under $75,000. If one qualifies that, one has two true benefits of this EPIC program. It's not a Part D plan. It's a program from New York State. I'm a big fan of it if one qualifies. And what it helps you do is, one, once you meet the copay of this EPIC program based on the income, then no medication that's Medicare approved can be greater than $20. So the medication part of this business that we're in is an all-year effort for us to support people. EPIC has helped people immeasurably save money on medications. The other thing that EPIC provides is actually a special enrollment to make a change to your plan one additional time during the year. So if for some reason your plan doesn't work, or maybe your doctor no longer is taking that particular carrier, if you're on EPIC, you actually can make a change during the year. There's so many little pieces within Medicare. Over the months and years that I will be a part of this radio show, I will hopefully help you understand that it's true. One size does not fit all. But it's about managing your healthcare costs. So to understand what your cost will be, whether it's on a group plan, whether you're a veteran and you get some coverage from the VA and want a backup as another plan to have for local doctors, everything has sort of a right way and a confusing way to go about this. People are worried about having the right Medicare coverage, and I can tell you that that's what we do as a company. So again, Mark Brownstein, Emerald Medicare, 845-358-1220, emeraldmedicare.com. It is always so nice to be able to talk about what I do in a simple way. But over time, I'm going to be bringing in guests that could talk about other things, people who have worked with me, worked with my company, people who I value tremendously in terms of their knowledge and ability to educate the community on issues that are important to people who are listening here on the radio. This is a wonderful time of the year, I hope, for us to pull out of COVID, to look at spring. Though it's cold out today, it's Valentine's Day. It's the day after Super Bowl. Hopefully people are feeling a little bit better about what's possible. So I'm really grateful to be able to educate you today. There are so many Medicare roadblocks and mistakes. My goal is to give you the big picture, give you the Medicare essentials that you need to be able to move forward, and always grateful to be able to help anyone that I can, along with my team, in the work that we do in Medicare. Thank you, and have a wonderful, wonderful day. Thank you.